welcome everyone to News from the Front, a global channel wherein Elsevier will bring you opinions from frontline healthcare workers involved in the fight against COVID. Today we have with us Dr. Raymond CHOY from Malaysia. As of 24th March, we have 336,000 COVID-19 cases in the country and 1,244 deaths. Dr. Raymond CHOY is the founder and CEO of Doc2Us, an online consultation platform that has been connecting patients in need with doctors during these difficult times. Dr. Raymond is a strong believer of the holistic approach to patient treatment. He completed his medicine across the La Trobe University, Australia, International Medical University, Malaysia, and the University of Manchester, UK. He has also earned degrees in aviation medicine from Singapore, as well as in health leadership management. We are very happy to have you here with us, Dr. Raymond. Thank you very much.
Thank you very much, Natasha. That was a very thorough introduction. Thank you so much.
So would you mind sharing us a little bit more about Doc2Us and how you have supported patients during COVID-19?
Sure. So Doc2Us actually, it sounds like talk to us. So it started with the idea of, we want patients to talk to us, which is talk to the healthcare providers. That's how it started back in 2015. So it basically is a platform where we actually provide this solution to the public, consumers, employees, and patients and whatnot, so that they can connect and communicate with the doctors and healthcare providers of their choice via text-based model or video consultation and whatnot, and all the way to prescription electronically and medication delivery. So it's an end-to-end services that we provide within the whole ecosystem. And because of COVID-19, and we also actually rally a group of very dedicated volunteers who are healthcare providers of different specialties. We have specialists from infectious diseases, right? And we have consultants and whatnot, and also general practitioners, family physicians, pharmacists, dentists, and even nurses who actually came forward to want to do something for the country. That was back in last year, March, while we started to have the lockdown in Malaysia, right? So because of that, we rallied initially about 50, and subsequently we actually scaled up to even 120 who actually voluntarily came forward to help. So how did they help actually? So we actually provide the platform for them so they can go online any point of time to answer the public about COVID-19 related matters. That will not be any charges, and it's free, and it's real time answering. It's not an email kind of So that's how we work, and we got quite a good traction, because that time the lockdown was the first lockdown. Everyone was confused, was anxious, right? And they do not know, what to do next. And that's hence we got a lot of queries. Should I go for COVID test? What should I do now? Things like that. And we even had a psychologist as well to help with the anxiety part of it, to comfort some of the patients and parents as well, who are kids, and elderly at home. And till now, we are still providing the same solution. And because of our initiative, actually, it was picked up by the Ministry of Health Malaysia. So back in, I think, July, we managed to integrate into Malaysia contact tracing super app called My Sejahtera, where everyone would need that super app to, when you go to any place, you need to check in, so that the government would know, the ministry would know where you have been for easy contact tracing. So in that super app, you have a free virtual health advisory, which integrated to ours. So we are actually seeing that more public from the My Sejahtera super app and directly linked to our healthcare provider, so that they can actually inquire our healthcare providers about COVID-19 related matters. And most importantly is actually there's a huge gap between the patient and the ministry because of the huge load. And we were dealing with few thousand cases a day for the past few months, right? And the government, of course, they have the capacity issue. So, those days we're dealing with patients who are anxious about COVID-19. And, last few months, we're dealing with patients with COVID-19 online. They're staying at home self-care. They do not know what to do next after being tested positive, because there was some backlog of, in terms of, the authority calling them, contacting them. So we actually fill in the gap to answering the questions, what to do next, when should you go to see the hospitals and whatnot, and who to call. Now it's stage 7, what should you do, and any symptoms or not. So we have been dealing with COVID-19 positive cases at home remotely. So that actually even let us see the more values of telehealth or telemedicine in that space, really.
That's excellent. That's excellent. So there was a lot of things that you shared over here. And I'm going to actually start with the last part that you just talked about, the fact that you're
Sure.
actually dealing with the COVID-19 patients and informing them about what they need to do for their health and when they need to go for a checkup. I know in Malaysia, one of the biggest problems was the infodemic, and there was a lot of fake news and incorrect information going out to both patients as well as the normal people who are not suffering from COVID. So how did your team deal with that fake news epidemic in the country?
Yeah, it's a very good question, Natasha. I suppose this is not only confined to Malaysia. It's a global issue, fake news, right? Fake news actually spread faster than COVID-19 because of the internet era, right? And hence, right, it is a very tough situation. And you know, we ourselves from the ground up, right, and from Doc2Us point of view, it's not going to be very impactful. Of course, there are things that we can do to have a little bit impact. It's a snowball effect. If everyone does their job, then you will have to, you know, to actually clarify things, you know, and whatnot, to bring the patient back to the evidence-based medicine, right? And I think most important is the top-down approach, where I think the Ministry of Health of Malaysia and the government, you know, and the multimedia, all this, right, they have been doing their work, right, to really try to curb down this fake news. As I say, fake news travel faster than COVID-19. And hence it comes with a lot of challenges for the authority, for the policymaker to curb it down. Of course, there are all these acts and laws and whatnot and initiatives to curb it down, right? But it's just because of you and I know that the internet era is crazy out there. You know, split second you have millions of messages in Twitter, in all the social medias. How are you going to curb all this? Yeah, you can actually have AI, all this, but yet there's still ways people spread, you know. And hence, you know, I think I saw what I saw was that, you know, the Ministry of Health has been trying really hard to try to, you know, debunk all the myths, right? To tell us this is fake with all the posts. Yes, I think they're doing a great job, but whether that we can keep track on the pace of all these people, right, with different agenda, I think there's a whole lots of story, different ball game. I know from ground up, actually, we are doing our part to you know, we have patients sending us, you know, the picture, the image of the post of other people saying, is this true, or is that a treatment for COVID-19? You know, things like that. So we have to
So
use
patients are sending this,
yeah,
or people are sending this to your platform to confirm.
yeah, absolutely. So they send to then our because our healthcare providers is, you know, it consists of range of healthcare providers, right? Sometimes we might not be sure, right? Hence we have our task force group, right? 120 of them with supervised by the infectious disease specialist to actually discuss cases. If we're not sure, we discuss, right? Is it true? What's the evidence behind this? What's the research behind it? So that we can answer the patient in a more accurate, a more evidence-based manner. So this is our value to the patients, and we want to guide the patient back to the, even right now, patients are asking about COVID-19 vaccines causing death, right? So it's our role and duty to really, you know, to help to rectify, to actually bring down the hesitancy. They are not, most of them are not anti-vaxxers, to be honest. They do go for their annual vaccines, you know, for the flu, whatever, but they're hesitant about this COVID-19, a lot of them, right? So it is actually everyone's role, not only our role, but everyone's role who actually believe in this, the science of this, right? To really use different language and wavelength, right? And channel to reach out to people, especially they're hesitant. Only then we will be able to reach herd immunity at some point. So it has to be top-down approach and also ground up. When the ground, it should be from one member to your community, and from your household, you spread, right? So that will
it's like an ecosystem.
That's an ecosystem. Then only then we can actually speed up the herd immunity process. But otherwise, right, when, you know, I'll watch and see, that's what a lot of people's mentality. I'll watch and see. I'm not anti-vaccine. I'm not an anti-vaxxer.
But they just
I
want
watch
to
and
wait.
see. But if everyone is waiting, right, nothing going to be done, and we will not reach a herd immunity.
True.
So it's very important, right? The information that we provide must be true, accurate, and evidence-based. Of course,
Right.
the way we provide the message to the people, you have to understand what's the level and background of the person. You cannot provide
That's
a lot of
correct.
figures to the lay person or to the below 40 group, right, which is an underprivileged people. You bombard them with all the figures and whatnot, you know, how many died. They can't comprehend it. You have to go down the level and communicate. So that's why I said the ground up and bottom and a top up approach, right, with the right channel, right language, and the right kind of a wavelength. Yeah.
Right. And I also believe that timing also matters. We need to be able to give the right information at the right time. There's no point talking to people about vaccinations if vaccinations have not started. It's only when
Absolutely.
vaccination starts, then you start talking to them. So another question that I have is, you have an extremely diverse team, as you mentioned. You have many different types of specialists, and then you have an infectious disease specialists to monitor their work. So how do you and your team keep up with making sure that you always have the latest evidence that you are using and sharing with the patients?
Yeah, that's a very good question. So you're very right. We have a very diverse group of healthcare providers. It's not only the private sector, but also the public sector, including the public health and the policy side inside. And we have Frontline as well doing the swaps and so protocol in terms of logistic, right? We have people who actually know what's going on the latest, where to send, what number to call, right? And because it's ever changing, the policy due to this unprecedented COVID-19, right? Because today you might be needing to quarantine at the center, tomorrow you might be needing to quarantine at hospitals and whatnot, right? So we have
And
the
it
Frontline.
changes in a day.
Yeah. So
Yeah.
so we have to keep track, right? But how do we keep track? Is actually one is actually through all the portals of the government portals that we keep track ourselves. Then we actually discuss, we send, this is the latest. And two, by having the ground people working with the government, working with the Ministry of Health, that will help to keep ourselves updated. And three, with all the like infectious disease specialists to make sure that whatever we're practicing, whatever information we're providing the patient are safe, accurate, and evidence-based. So these are the three things that we want to make sure, because otherwise we are not different from those people who spread fake news.
Exactly.
Because patient
No different from
believe you.
Google then.
Yeah, because patient believe you are the healthcare provider. You cannot give unreliable info. We have to make sure everything is right and up to date. And that also comes with a challenge because this COVID-19 is unprecedented to everyone on earth.
Yeah.
Right? So no one can
Absolutely.
tell you what to do is 100% right.
There's
No
no
one can tell
one
you.
correct answer.
There's no one
Everybody's
correct answer.
experimenting here.
It's really trial and error, right?
Yeah.
But ultimately, it's really about how safe we are in terms of our policies and all right, and really how can we reach the herd immunity and back to old normal as soon as possible. And yeah, so we have the role and duty. So that's why I'm also very concerned. Whatever info that we give, right, must be true, and we do audit.
Right.
And the good thing about digitalization is our medical board is able to audit randomly all the lots, not all the lots, but random pick on the lots, especially those new joiner. We handhold together and go through with them. Yeah, and also we always tell them, you don't have to be hero. We are not here to be hero. We are here to work as a team, 100+ of them, right?
Absolutely.
Don't be shy. If you feel that you are not comfortable to answer the question, post it in our group. Within minutes, right? Our specialists, all this will come in and bombard with the information.
And this is your internal company group where people can get help.
Yeah. So our task force, about 120, is for the public. But internally, this 120, we have our own task force. We use WhatsApp, basically it's quicker and it's more common for everyone. Then we discuss cases. And if I've got this patient coming with with coughing out of blood. It's a true example of this one. We have patient COVID-19 coughing out blood. What should I do now? And
he must have been so scared.
Yeah, she's a pharmacist. She wanted to help.
She must have been really scared at that point.
Yeah, but the good thing, she recognized the red flags, right? She knows this is something serious and she needs help. So she posted on our site. Then she said, hey, this is the story, the history, and the patient current is this, and the status. What should we do now? We even have paramedics in our platform.
Right. Okay.
Right. So then the doctors will come in. Oh, can you assess this? And can you tell her to say, can record the voice? Can they speak up? In full sentence and whatnot to assess how breathless she is and things like that. And so we have all this, and going to that, I feel really, really motivated every time I see these messages. And then in the way we even arranged logistic for this patient, ambulance.
Okay.
For this patient. And we have cases like the whole family, the two elderly parents and the daughter who actually dial into us, right? And 3 of them are COVID-19 positive.
Oh gosh, okay.
Right, and now I'm really having breathlessness right now. What should I do? My parents are still okay, that kind of thing. So he said, oh, now you should call the
she's nervous, she's breathless, she's panicking probably.
Yeah. So there's a lot of reasons, right? So we're here to support to make sure that we get them to the right channel if this is a serious case, then we need them to go to a hospital, get the ambulance, right? And because you're COVID-19, so we have coughing out blood, we have things like that. We have elderly staying at home alone. The kids, call us, and because the elderly is COVID-19 positive alone. So we have cases, a mixture of cases, and some actually COVID-19, but absolutely well, but needing some refill of prescription.
Yeah.
But they are not allowed to go out.
Yeah, they have to be homebound.
So we actually convert the virtual health advisory, the VHS, right? Convert to virtual consultation. We actually direct them to the doctors and all the way to medication delivery.
Right. Yeah, actually, that was the most interesting thing. That I think you guys are one of the first to do online medication delivery in Malaysia.
Yeah, first few. I think first few. I think we started in 2018. The medication delivery 2018 for corporate clients. That one we started. Yeah.
Okay. So that was for corporate clients, but now you're doing to individual.
For individual and even international patients.
Oh, excellent. Interesting. Yeah. So what I find very interesting is that you're using very simple technologies, both for your internal group also and for patients also. Simple things like WhatsApp and basic video consult. What's your opinion on this?
Yeah, I think ultimately all these are just the tools, right? And WhatsApp is actually when we discuss among our task force, right? It's actually no identifiable data.
Right.
Yeah, okay. Because WhatsApp is still not a medically inclined environment. But for patient side, it's actually a medically environment, so which is our own platform. So it has to be safe.
That's where your proprietary platform comes in.
That's our platform, and with blockchain technology, all these, right? Prescription with digital signature system and whatnot. So for internal discussion, then we use WhatsApp because it involves so many people of different places, and they are not our regular healthcare providers. These are the volunteers who came to us, who believe in this. So to start, because everything had to be started fast, right? Yeah. So I didn't want to build a new platform for the healthcare providers. We don't have time that time, right?
Don't have time, of course. Yeah. All the resources.
Absolutely. So if you ask me, right, and I give you an example, hospitals in Malaysia and maybe in other countries, right? And they have been talking about telemedicine, telehealth for quite a few years, but nothing has been really done, right, and materialized because hospital information system is very complex and expensive.
Very expensive.
If you go into it and touch something of it, right, it costs a lot and it's very time consuming. Usually, you want to integrate telemedicine, easily it will take 3 to 4 years because of the whole architecture.
Years and a lot of money. Just tweak the existing system and add a telemedicine consult, it takes a lot of money.
Absolutely. So, but what COVID-19 has taught us, right, is the hospital roll out in 4 weeks' time.
Yeah, exactly.
So they're really right, and of course, a lot of them no integration. They reuse what they're available to reach out the patient because there are 70% drop of patients coming to them in private hospitals, right? So they use Zoom, they use Skype, right? Yeah. They use WhatsApp to reach out to patients. So and to me, all these are tools. As long as you have the really good protocol in safeguard all the data and whatnot, right? I think as long as you can communicate the patient find easy. The adoption, there's no barrier to entry. I think that's the whole purpose of telemedicine, right? It's really about establishing a communication tool between you and the patient. But what is more important?
At your end, you're using a secure platform founded on blockchain technology, but the patient doesn't even need to know that. They just need to be able to communicate.
Yeah, some of them, they just want to communicate, ask a simple question. They just want it to be answered, right? And what is more important is actually you have the platform to actually connect the patient, whether you Zoom or whatever. It doesn't really matter to me, to be honest. It's a communication tool, right? But most importantly is how can you actually enhance the whole journey? It's really what's next after your video. What's next? What's next?
Maybe he needs medicines. Maybe he needs.
Yeah. What's next? Do you have the a robust system, a seamless system for the patient journey and experience? And then that is actually what set other players apart from each other, right?
Excellent.
Those ecosystem players we have a better upper hand.
Who have the whole journey to support other ones who will succeed.
Hence, we actually, for the past 3 years, we have been focusing on all the pharmacy network. So we build network effect, right? So we have 300, by this year, we should have 1,000 pharmacy outlets using the solutions. Wow. So it's an end-to-end. Yeah. So it's still about 30%. We are targeting 50% of a pharmacy, which is 1,500 pharmacy outlets. adopting our solution.
That's a
So
huge network.
yeah, so we are really playing the network, the ecosystem game, so that we always have the what's next for the patient. Anyone can come up with a telemedicine. You can come with telemedicine in about 1 month time. To be honest, it's not that rocket science, to be honest, but it's actually the what's next, the whole journey. We actually prepare the whole journey for the patient. That's more important, all the way to the lab. We even integrated with the lab as well, right? So it's really about the ecosystem and the patient journey, and of course, ultimately, it should be cost effective, simple, right, and efficient, and of course, safe and whatnot, lah, right? And so that's where the innovation, the disruption comes in, rather than just a telemedicine solution alone. Yeah.
Right, sure. So I'm going to try to come back to the cost question a little bit later, but there was another important question that I wanted to ask you. One of the challenges in Malaysia was that there are a lot of people who suffer from chronic diseases like diabetes and hypertension, and they weren't getting attention because people were so busy with COVID-19 and appointments were canceled. So how did you support this category of chronically ill patients through your platform?
Yeah, thanks, Natasha. I think that's a very good question. And if I bring you back, if I may bring you back to 2018, where we started our first corporate solution in Malaysia. We were the first one, started the corporate solution, right? Taking care of the employees virtually. We actually, we didn't start for acute minor ailments because we thought the risks were too high and people were not there yet in terms of telemedicine. The mindset, the mentality are not there yet, right? And even adopting telemedicine is something new. So we started from long-term medication refill, like what you say, refueling prescription online. So we actually, target those people who are on long-term medications to actually consult our doctors online. If it's deemed appropriate, fulfill our criteria of a 3C. We have the 3Cs approach: compliance, control, and no cautious side effect. So if they fulfill the 3Cs, right, then our doctors will prescribe electronically in a remote way, right? And then we will send the medication to you. So likewise, for fast forward to today, COVID-19, the whole ecosystem has been built all the way, even logistic, everything as well. We integrate with a logistic partner as well, right? So when the whole ecosystem is built up, then today patients not keen to get medication from clinic because of the risk, right? We saw it a lot last year. So they actually look out for solutions. How can they continue their medication without needing to go to hospitals or clinics, right? Hence, they actually consult our doctors online, and then we send directly to the home. Yeah.
So it's very interesting. You already had the infrastructure and the network ready to help those patients.
Yeah. So that will actually ensure a better user experience. Of course, during this COVID-19, we also saw a lot of hospitals using WhatsApp, and pharmacy using WhatsApp, right? And to actually connect the patient. Hey, do you want to continue your medication? I can, because everything is within the hospital, they can actually do the EMR, so it's fine. They can prescribe and dispense within the hospitals,
within the hospital,
and then they send to you. So it's still okay. But for us, because we are doing everything remotely, because my doctor might be seeing the patient in Sabah, but I'm still able to send medication from somewhere around the region, Sarawak to Sabah, which is quicker with our network effect.
So just for the context of our users in Malaysia, generally, it's very hard to get an electronic medical record outside the hospital. So that's why the hospital has an in-house pharmacy and they use the hospital's patient record to send. But in your case, you're not attached to a hospital. You're actually working remotely. And that's why it's harder for you to be able to coordinate with pharmacies and the patient record.
Yeah, you're absolutely right. So we are building the hospital outside hospitals in a way.
Exactly.
Clinic outside clinic. So we believe the personal health record, all this is actually belongs to the patients and share among the healthcare providers, the authorized healthcare providers, for the patient's interest and health benefits.
Which is actually a very new concept for us.
Yeah.
The fact that the patient record should be owned by the patient, that's a fairly new concept in Malaysia.
Yeah, I mean, you and I know that, right? This is, I'm having high blood pressure, right? And I should be empowered to know what I'm taking. How's my blood pressure progress like, right? What's the next step? What's the future plan for me? So I have the right to know. And a lot of times, patient might not be very well equipped or empowered in such a way, right? And if you go to this place, it's fine. You have a record within the premise.
Yeah.
Right. But what if you travel? You go to other premise.
Exactly.
Yeah. So of course the government is looking at the national health record, which I think we have been talking about this for quite a number of years.
Yeah.
But I mean, I must agree, it's a hugely challenging area because of the fragmentation of the whole healthcare system. We have the private sector with the public sector, with the GP specialists and whatnot, right? And the labs.
And there are so many other factors, the demographics, the size of the country, the size of the population. It's not easy.
It's not easy.
Factors it's not easy. Which contribute to the challenge.
Absolutely. It's very challenging. It's not easy. But again, we shouldn't take this as an excuse of not doing it. Sure. Right? We should take our baby steps, one step at a time to do it. Right? If other countries can do it, why can't we? Right? Right. Sure. If China nationwide can adopt e-wallet, why can't we?
Why can't we? Absolutely.
Right. The population is how many x, 10x or more than us, right? Whatever, right? So why can other big countries do that? We can't. Okay, it's not a small country. How come Singapore can do it? Why we can't? Are we taking this as an excuse? But I'm sure ministry has been working really hard on that. But at the same time, we shouldn't take this as an excuse right to say it's really hard, challenging. I mean, really, we need to find ways how to work with different stakeholders to come together, right? And to do a plug and play. This is fragmented. We have to acknowledge that it's a fragmented healthcare system, right? There are so many EMR systems, hospital system in-house, right? But how can we bring everyone together, to really for the benefits of the whole country and the nation? Ultimately, it will have to save costs as well.
It'll help to save costs. It'll help patients, especially the patients who are the biggest cost burden. The diabetic patients in Malaysia are the biggest cost burden. It will really help those kind of population groups.
Yeah, so it's really about continuity of care and in a more coordinated way, right? And which is what we are trying to come up with something called the coordinated care at the primary care, because we are very focusing on primary care. So we want to actually test out the primary care network effect, and then to use this as a use case. Of course, the number might be few 100,000 or even 1 million patients. It's not a huge number as compared to the whole general population. But we want to showcase that we want to bring NHS from the UK. I mean, we're a very idealistic way, right? We are working on that, right? And leveraging on what we have to actually scale up for out-of-pocket patients. Right. Okay. You pay, but you pay at a more cost-effective way, right? You get rewards. If you don't develop this, you don't use our service, you get reward, things like that. So we're actually working out on that, and so that we can actually let the government know, look, we have this model. Can we work on that something and in a larger scale for the national level? And telemedicine is just one of the enabler too. We need telemedicine for this to work, because we cannot afford to have patients to go to clinic all the time. Exactly. It's too costly.
And it's not safe for the patient, and it takes too much time for the patient to go to clinic all
so we have to bring in the digital solution, even the IoT monitoring, all this, right, to come in to make this work, right? You only go to a hospital or clinic when it's really necessary. And hence we want to reduce the tertiary care.
Right.
We are the strong believer in primary care. If it's done right, coordinated way, then you can reduce a lot of complications. Right.
And we have seen this. Sorry.
Yeah. Of course, it involves a lot of public health and education and whatnot, right? And this is really disrupting the whole health-seeking behavior from the patients. Hence, this is our ultimate big project, and we are actually working on that. It's really, really challenging, but I think we have the mission to do that, to make sure everyone wins. Because GPs are suffering. GPs are suffering, right? And they're not getting much patients. How can we create a symbiotic environment? Pharmacies and GP work together. They actually, get the patient's group, and the patient will get what they need as well. Right. The hybrid care, online and offline. And so GPs might see me as a threat all this while. But to be honest with you, right, we want to help the GPs, right, by helping you to digitalize the practice, by bringing more traffic to you. And hence we believe digital healthcare
solution. I think COVID is a big enabler of that. I think with COVID, a lot of GPs have realized that they need to digitalize and invest in maybe telemedicine or at least some kind of digital consult. Otherwise, they won't have any patients coming into the clinic.
Absolutely. The burn rate is so high, and yet your revenue comes down because of COVID-19. And hence we are seeing some GPs, they realize we are taking away their patient because of corporate. Right, we are seeing more corporate patients now. They're seeing less now, right? So they realize we're actually seeing their patients. Then they came to us and said, "Can we be part of you? That is a very right mindset. Then, of course, we want more of you, right? So that the patient can have a better continual care rather than seeing our in-house doctor who actually do not know them that well. I prefer them to see the treating physician online and then subsequently 6 months later see you offline to do the blood test, whatever. This is our ultimate. I'm not here to take away your patient, but this is the trend. People are
yeah,
going
it's where the industry is moving towards.
Yeah, I don't do it, other people will do it. Your rice book will still be taken by other people.
Exactly.
But I prefer I do it. We do it, because I prefer, because we are healthcare professionals, or everyone. I know how you feel. I want to help you, right? Of course, I don't see this way, right? But ultimately, we are working our way to see how we actually can help GPs really.
Right.
So this is our mission as well. Yeah.
Great, great. So in that case, I just have one final question for you. And my question was, in Malaysia, we have seen a distinct rise and fall of waves. There was the first wave, and then there was a drop, and then there was a second wave, and then the second and the third lockdowns. So across these waves, what were your learnings? Is there something that you took from the first wave and applied to the second wave? And how is that information being filtered across the waves?
Yeah, is another very good question, right? And I suppose I think there's no right or wrong answer, because this is unprecedented, right? And yes, you have the first wave. We can learn certain pattern and preventive measures, right? And tactful methods to tackle that, right? Yes, we can do that, and we can actually look at the R0 and and project how we're going to do, what we're going to, when we're going to have a lockdown and whatnot, right? When the second wave comes, is it the same, the applicable? Might not be, because you have a COVID-19 variants also. Then you take also, you never know, right? And not only you look at the wave itself, you have to look at the economics as well, right? You're talking about the life and the livelihood of people. So your policy is not only about the life, but also you have to look at livelihood.
The livelihood, the business.
The business, people are not able to bring the food back to the table. How are they going to survive? Yes, they survive the COVID-19, they don't get contracted, but they're hungry, right?
And that's a big problem, if people,
That's a big problem. So
people are not making money, it's a big issue.
absolutely. So every wave is really about, yes, you learn from previous, you have to unlearn and relearn. You really have to unlearn and relearn the whole pattern. It might be different because every wave is different. Socio-economically is different. The COVID-19, yes, it might be the same, but your demographic might be different, right? Your location might be different. The cluster might be different, and your healthcare providers, your frontliners might be different. They might be burned out after a few waves, right? Your strategies and policy might be different. I suppose your first wave might be 100% full force, but now your frontline are burned out already.
They're tired, they're burnt out.
They're tired. So what's your extreme measure? Do you need to use a dentist? Do you need to use a medical students like other country? Right? So it's really about, not about every wave is the same. We get to learn something, but we need to unlearn and relearn the new wave every time. So that is the challenge, and this is just my 2 cents really. I mean, I'm not a policy maker. I mean, this is just my 2 cents. Yeah.
No, that's very interesting. That's a whole new perspective that we've heard so far, that the fact that things change with every wave and you have to unlearn and relearn. That's very interesting. I think we've had a very, very useful discussion today, Dr. Raymond. I think all the points that you shared about COVID, about technologies, about adoption of technologies, it's really interesting to hear, and our viewers would love to watch this. I'm going to pause here. Any final words before we close?
Well, the final word is, we hope this COVID-19 will be over very soon, and please, everyone, stay safe and and be positive. So we are getting there, and don't give up, right? So